Well, hello everyone. This is Dr. Amig, your friendly rheumatologist, and I'm so glad to be here for another video of Rheumatology 101. I was on vacation. I'm back in beautiful Denver, Colorado. Okay, today we're going to talk about why you develop joint pain. And I think it's a very important topic because it's one that many people ask me about literally every day when I say that I'm a rheumatologist. So there are many reasons why you may develop joint pain. The first one is that, well, you have a trauma. So, for example, rock climber can develop joint pain if they overuse their hand. If you're a builder, if you're like using your hands a lot, you may actually develop joint pain. That's normally you realize it and you stop using your joint when it happens. But really, what you want to pay attention to is if you're doing something that's usual and suddenly you have joint pain that you used to not have. And that's what we're going to talk about. Okay. So, joint pain. So, the first thing is what's the joint? The joint is basically the intersection of two bones, and it's basically the association of the capsule that keeps it together as well as the ligament and the tendon. Okay. And so, really, you have like interconnection of tissues that are all soft with inside some synovial fluid that makes it that it's very nicely that it moves nicely, and then you have the cartilage under that has an incredible power of resistance that allows you to have this cushion feeling, and so it doesn't grind. Okay, once you understand this, then you understand why you may have joint pain. You may have joint pain because you've lost the cartilage. And then we'll go over in a little bit about why you would lose the cartilage. So if you lose the cartilage, in the cartilage, there is no pain sensory. So you don't feel pain when there is a problem with the cartilage. You feel pain when there's a problem with the bone. Okay, so there's cartilage. So if you don't have any more cartilage, you're going to have pain when there is this pressure bone on bone. You may have pain because the ligament or the tendon are are having issues, and then you may have pain because the capsule or the inside of what keeps it together is inflamed or is distended. All right. So we talked about the first thing, which is trauma. So, for example, you're skiing and you're doing a trauma. You're having a problem with your ACL. That's pretty obvious. You understand what's going on, but that will cause joint pain. You can have joint pain because you have overuse. So we talked about rock climbing. We talked about the people who use their hands a lot. So if you're a kneader, you're going to have a pain issues of your hand. If you are running and you don't have a proper posture, you may develop joint pain with time. There are genetic components to the joint pain. So if you have, for example, we often say that woman, like mother to daughter or grandmother to granddaughters, you can develop osteoarthritis, which is wear and tear of the joint. And then you have a possibility of infection. So, for example, Lyme disease can cause joint pain, joint inflammation most of the time of the knees. And you can have, like an infection that causes inflammatory arthritis of all of the joints, really. You can have rheumatologic disorder. And so rheumatologic disorder, we're talking about rheumatoid arthritis, psoriatic arthritis, lupus, gout. Really, any sort of rheumatologic disorder can cause joint pain. And the thing that you want to know, and that's what I'm going to leave you with, is that there is a way to differentiate between what we call a mechanical joint pain. So mechanical, it's due to overuse, it's due to trauma, or inflammatory joint pain. And the inflammatory joint pain are the one that you want to see a rheumatologist for, and are the one that you're going to want to treat. The three questions that you want to ask is the pain worse in the morning? If the pain is worse in the morning, you're talking more of an inflammatory joint pain. Second, is the pain associated with morning stiffness of more than half an hour? So in the morning, if you have to do this, or if you have to move like this for more than 30 minutes, and you're like, I'm not settling, I'm just really moving for more than 30 minutes, that is what we call morning stiffness, significant morning stiffness. And then the third one is, does your pain gets better with exercise? And you know who you are if that is the case, because most of the time, if it's mechanical, the pain is gonna get worse with use of your joint. If it is inflammatory, it's gonna get better. Okay, those are like the three things that I wanted to discuss with you. If you like this channel and you want to have more questions answered, I recommend you ask me, because I would be happy to talk about more rheumatologic questions. And if you are looking for rheumatologists in the Denver area, Colorado, I'm currently open for new patients. This is a direct care concierge practice, and I love what I do, and I would love to take care of you. So you can contact us at info@onabridgemd.com. Have a wonderful day. I'll see you next time. Bye bye.